Well, I want to welcome you to today's broadcast. We have with us a special guest, Dr. Michelle Wendling of All Seasons Chiropractic. She's actually been our personal family chiropractor for many years. I don't know if it's been, do you think it's been 15, 16 years?
I think it's been at least 10.
At least 10.
Yep.
So, and we're both Marjorie, my wife, and I, and even our children are healthier as a result of that. So thank you, Dr. Michelle.
It's been my pleasure.
So I wanted to interview Dr. Michelle because I've worked together professionally with Dr. Michelle, sending patients back and forth over the years, and she's done some pretty amazing work. And I would say that we kind of work on things from a different angle. We have the same kind of mindset, but she can get to things that I don't have access to because and vice versa. But the purpose of today, I want to kind of get an idea of what Dr. Michelle, what your particular niche is. But before we get into the details, let's just maybe talk about how did you come. Matter of fact, why don't you tell us about your background? It's a little diverse. I think I'm not remembering everything, but I think you've done personal training, you've done physical therapy, etc. Why don't you tell us about that, and then how did you come to chiropractic as your profession?
Absolutely. So I've been working on the human body about 28 years. So it's been an awfully long time. I started doing massage when I was 15, but I always knew from a really, really young age, I wanted to make people feel good. That was always my goal. My dad likes to tell the story of, kindergartners sitting around and one of them's like, I want to be an astronaut and I want to be a cowboy and I want to be a nurse. And I was like, I just want to make people feel good. And so he tells that story and it always makes me laugh. I don't remember the exact moment, but the way he tells that story is so great and it's so me. So when I got to experience massage therapy, my grandmother was a massage therapist and a Reiki master. And so I got that exposure. And then I realized that wasn't enough. And so then I started bodybuilding and started professionally bodybuilding and whatnot. And then I became a personal trainer, realizing that massage was great to get the muscles mushy, but we needed some stabilization to get the muscles turned back on again. And then through physical therapy, I worked in physical therapy for about eight years. All over the country, actually, in different places. But my favorite place of all time was when I worked in San Diego, because those people were actually trying to get back to things they loved, as opposed to just getting back to what we call normal life. And so I was like, ooh, how can I inspire people? How can I inspire them to want to do the things they love on a regular basis? And then I found chiropractic due to an injury. And after getting treated with chiropractic, and I saw one physical therapist, and I was like magically better. And I couldn't even walk after the injury. It was crazy. So I was like, well, that makes perfect sense. And I discovered that the key is not the chiropractic adjustment by itself. It's the combination of the adjustment and the immediate restabilization. And so that's how I kind of came to chiropractic, because that license encompasses everything I want to do: the soft tissue from my massage background, the physical therapy, the exercises, the strengthening stability from my bodybuilding background, and of course the adjustments and getting everything moving. So it all works beautifully together now that I've had a ridiculous amount of education and time working on people.
I can relate to that.
Right?
All right. Well, so you've talked a lot about creating sustainable health and other discussions. What do you mean by that?
Yeah, so that goes to what I was just talking about. Sustainability means that it's not necessary to continuously have someone else help you out, right? Sustainability, my definition is that you, in and amongst yourself, living on that Caribbean island in the middle of nowhere, can still get yourself better. And my goal in my practice is always to create a world where you have the tools to get yourself better. I absolutely will get things moving and start things in the right direction, but the patient education and the exercises you get here create a world of sustainability. And I might even say invincibility, because once you get really stable and really structured, you don't have to worry about injuries. You can go down a mountain at 1 billion miles an hour and, hit a mogul, and your body will be like, yeah, bring it, as opposed to being like, oh, and like falling all apart. So that creation of sustainability, again, like you talked about with the food changes, if you do them, they will work. And if you don't do them, I can't help you.
Right. Very interesting. All right. Well, let's switch gears a little bit. So what would you say the basic rules of the body are when you're treating an injury? You mentioned you had an injury yourself, and maybe you can use that as an example, but what are the basic rules of the body when you're treating an injury?
Well, there's a couple rules of the body that I always go back to. The first one being is that the body's always looking for safety, always. That's true of our gut, right? You know this. Our body's always looking for safety. It's looking to protect itself from anything out there, right? We have evolved over time. We had lots of things coming at us. And so our body's really designed for safety. So if the brain perceives something not to be safe, it kind of goes what I call scared bunny rabbit mode and locks down the system. So for instance, something like frozen shoulder is, generally speaking, not the tissue's problem. It's the brain who says, nah, we're not safe to move. But if you totally knock that person out, you can move their arm full range of motion and they don't have any issues. So it's not the tissues that are the problem, it's the brain. So part one, you got to make the body feel safe and the brain feel safe in order to have movement. So that's part one. And I'll get into that a little more in a second. And then the second rule of the body that I think is super key, and you and your whole family has experienced this, and that's practice makes permanent. It doesn't make perfect, right? If you do something wrong over and over and over and over, that cheeseburger doesn't magically become a salad, right? You have to do it right, or practice makes permanent. So if you sit like this all the time and just kind of hang out in this position all the time, what do you get better at? Well, you get better at this position. And if you sit like this, you get better at this position. So the body likes repetition and it likes things not to change. The brain especially hates change of state. I could go for an hour on brain change of state stuff because that stuff's really interesting to me. But so whatever you do most often, your body gets better at. So all of the exercises that we do are designed, A, to create safety, and B, to change the state so that the brain continuously practices something. Like, for instance, if your pelvis is not stable, we do these things called butt squeezes, where you engage your glutes over and over and over until your pelvis becomes stable. And they're like magic. As soon as you do these exercises that are super simple, like immediately you get that sustainability because you're following the rules of the body, and you end up with no pain anymore, which is really kind of cool. So it's sustainable and better. I like that.
Actually, I would personally recommend the butt squeezes. They're amazing.
They are. They make your pelvis so happy. Your whole hips are so happy. It's great.
All right. So is there a particular protocol you follow, or?
Always, yeah. So in our office, it's always get the joint moving first and immediately stabilize it. So you'll never get an adjustment in my office with any body part, because we do feet, ankles, knees, hips, elbows, shoulders, jaw, everything, knees, all that. So you'll never get a joint moved that's a problem joint without immediately getting a homework exercise to go with it, because that's what's going to create the sustainability so that your brain feels safe to move the joint and your body will continue to get stronger. The reason that a muscle is tight is always because there's another muscle not doing its job. So that's what the homework is typically designed to do, is get the guy who's on vacation in Hawaii back to work and make the overworked, underpaid guy go off to Hawaii. Unfortunately, what you see in a lot of offices is they're going to work the injured muscle to get it stronger. But if it's overworked and underpaid, putting more stuff on its plate is just a silly idea, right? You wouldn't torture the gut if the gut was trying to heal. You want to take stuff off of the gut and put it on something else so that their body can heal. And same thing that we do in the office. We take the pressure off of the injured muscle rather than making the injured muscle work harder.
Wow, that's kind of that's a paradigm shifting idea. I'm glad you understand what you're doing.
It seems to work. How about that?
There you go. Okay. So yes. So how do you determine from a chiropractic perspective whether a joint is chemically inflamed versus mechanically irritated or even injured?
That is a super relevant question, especially for your practice, because you're the guy who's amazing at lowering inflammation and getting the chemical damage off of the body system. So if I find that the whole system is kind of irritated, things are kind of tender everywhere, that when I push in, the joint doesn't guard, I'm going to think that's more of a chemical imbalance. That's going to be more of chemical inflammation. Excuse me. And so that chemical inflammation is then we got to talk about diet. We got to talk about sleep. We got to talk about stress. We got to talk about those things, because all the adjustments in the world, even though they'll give temporary relief, you know as well as anyone that I will never be the chiropractor who's that expensive Band-Aid or that expensive aspirin where you just keep coming back over and over and over and over and don't get permanent results. So if it's chemical, I'm going to send them to you. I'm going to redirect their thoughts. We're going to look deeper and see what's going on in their world, see if they can get away from that chemical inflammation going on in there. Now, if a joint is damaged or injured in any way, it will absolutely guard. So I get in there, mobilize each individual joint, and generally speaking, there'll be a pain point, ow, and it'll be real specific. But if I turn it a different way and move it, it doesn't hurt. That's how you can tell that it's an injury versus just kind of overall chemical inflammation, which a lot of people have both. So there's that.
Okay, well, my brain is popping with all kinds of questions about that. And I'll just say that one of the first things, and you may or may not remember this, Dr. Michelle, that it's been probably 3 years ago, and you looked at my knee at the start of my journey, and you said, well, you said the meniscus is kind of wrinkled. And I thought, yep. Wrinkled? I've never heard of that before. I've heard of bucket tears. I didn't want that.
Nope.
And you encouraged me to, and adjusted it, and thank God, because it was a part of the process. I had both conditions in my situation.
Yep.
So anyway, that's all very interesting.
And if it slows the healing, like if they're not healing as fast as I expect, typically my patients are going to heal in 2 to 3 visits. They're going to feel way, way, way better. If they're not feeling way better, that means there's something systemic going on, and we need to look a little bit deeper with that, which, unfortunately is about 60 to 70% of the population has inflammation in their system, leaky gut, things like that going on. It's just the way the world is. So if I see that their body's not healing like it should, again, because it shouldn't take 10 visits to get better. That's just not a thing in our office. Like, you really should feel a lot better in 1 to 2 visits. So if that's not happening, then I think, there's something else on top of the injury, which I'll continue to treat the injury, but I'll certainly make sure that they've got other resources for the rest of what's going on there.
Absolutely. Well, that's a big number. You said 60 to 70% of the population has inflammation in your experience?
At least the ones who come in my office. That's a lot of people.
That's really amazing. Well, I'm glad that we have tools for that.
Me too.
How do you determine the best strategy biomechanically to, maybe you talked about this to some extent, but the best strategy biomechanically to return an inflamed joint to its, so we're talking about an inflamed joint to its optimal function?
Yep, absolutely. So, and I think, first of all, I could start by talking about how I know if a joint's inflamed or not inflamed, and what it feels like, how it feels different. Because if the joint's really inflamed, it's usually, if it's early on in the inflammation process, it's swollen, it's really floaty, It's got a lot more squish to it because there's way too much water in there. The injured hyaline cartilage and other things kind of absorb water and they bring water in so that the joint gets kind of sloppy. So the first thing you got to do is mobilize it, but very gently, and immediately restabilize it, because that extra motion in there causes friction and can cause more damage. And that's not the goal. So if all you do is adjust it and you don't restabilize it, you end up with a very, very unstable joint, which is so not the goal when there's an injury involved. So you kind of figure out where the range of motion is limited, and that's all done by touch. I've been touching people for 28 years now, kind of know what the body's supposed to feel like. So based on that, you figure out where it's not moving well, help it go that direction, and then support it with an exact exercise for that direction.
So when you say restabilize, you're mainly talking about strengthening and the homework exercises that go along with it.
Correct. And it's mostly a brain exercise. Most of the homework I give is to get your brain to find the muscle that's dysfunctional. So I help your brain figure it out. Like for you with the knee, the VMO was the issue, right? That inside quad muscle was not firing as quickly as it should. And that's super common with knee injuries. So with that knee injury, your brain and the VMO haven't talked in some time. And the brain was talking to the lateral quad instead, causing your knee to twist every time you took a step. And that's super common when you have a knee injury like that. So my job is to figure out which muscle's not turning on and then have a repeated engagement with that muscle all day. Most of my homework exercises are 10 reps every hour, because again, we're not trying to strengthen that muscle so much. We're trying to get the brain to access that muscle. The brain has totally gone to other muscles. It's like, meh, I don't even know that guy. I don't even talk to him anymore, right? And instead you have to be like, brain, VMO, nice to meet you, and reconnect them. And when you do that, it's amazing how much faster people get better rather than making the overworked muscle. If I went straight into strengthening, your outer quad would have gotten stronger and stronger and stronger, and that imbalance would get worse and worse and worse. It might reduce the pain for a little bit because the outer quad can do that, but very soon you'd end up with biomechanical dysfunction because of the pressure on the outside of that joint. So, you just got to figure out which guy's not doing his job and then get the brain to talk to him more often. And it's like a magic fix. It's really cool.
So otherwise it's like practicing a bad golf swing.
Over and over. You got it. Practice makes permanent, right? Exactly. That's exactly it.
Interesting. Do you have any tricks or hacks patients can routinely use to kind of get themselves back to desired function quickly? Maybe that's an unfair question.
No, I totally do. Absolutely. Every patient, so essentially there's 3 cores in the body. We always know about the one core that everybody talks about, which is our tummy, right? Everyone's like, oh, that's your core. Well, it turns out there's actually 3. There's a core that goes across your shoulder girdle right through here. And that's what keeps our shoulders down and back and protects our shoulders when we move them. And then there's the pelvic girdle too. And that's a core as well. If you can get the strength here and in the tummy core and in the glute core, if you get those 3 pieces working, you pretty much are heading in the right direction. It's kind of like, with nutrition, if you're changing your diet and you do a really good job and you stay strict with it, you're going to get there. You're going to get most of the way there. Now, yeah, you probably still need some help. You probably still need some adjustments to get there and turn muscles on and such. But if you start with those tricks, and you can watch those on my website, like on my allseasonschiropractic.com website, I have lots of videos about how to know whether to use ice or heat. So that's a good trick because a lot of people have no idea when to use which. I have stretches on there. I've got information on how to stimulate your brain by moving your body, all kinds of videos for people to watch and just kind of get more familiar with who they are and what their body does. But those 3 core exercises are on there as well. Now, it's best if you can get an assessment first so that you know what's wrong. However, just like with the food thing, if you want to do the blanketed approach of adding 3 core exercises to your daily routine, you're going to get better. You just will. You might not get all the way better, but you're going to get better.
Right. You might reach a plateau at some point.
I'm sure you'll plateau at some point. Absolutely. And that's when call the people who can help you past that.
Fair enough. Well, that's really cool that I wasn't aware that, I'm glad we're having this little talk. Aware that you had all that awesome content on your website. I'm going to have to go there myself and study it, and I'll be sending my patients there too. So
awesome.
How cool is that? Thank you.
Well, And I keep adding stuff. Like I have a video we're going to make next week on how to get rid of toe pain forever, because that big bunion pain is kind of a big deal. And I've got a trick for it that if you do that, you get no more toe pain. It's really awesome. And it's pretty much immediate. So little things like that, if I can help everyone out there, whether they can come into my office or not, I'm in.
By the way, I'll just put in a plug for Dr. Michelle here, that years ago, you mentioned, Dr. Michelle, that you did feet. I'd never heard of that. I mean, how do you do that? And I literally had a patient, an older lady that had her, her toes were like this, and I sent her to you, and you helped her.
Yeah, we got her walking. It was so awesome. She was having a heck of a time until then. Yep, my pleasure.
So how can our listeners decide whether their situation may be a good fit to utilize various types of chiropractic adjustment?
Absolutely. That's a great question. Essentially, it's not a bad idea to get checked by a chiropractor, as long as they're a full body chiropractor, which is what I always recommend, meaning that they will adjust your feet, ankles, knees, hips, shoulders, elbows, jaw, and the whole bit. Just kind of get a check from head to toe, make sure everything's moving like it should and your muscles are balanced. Now, that being said, nobody's going to go to the doctor unless they hurt. We know this, right? I mean, this is your world too, right? So we know this to be true. So if something hurts and it hurts for more than 24 to 48 hours, typically that means there's an actual issue. We all sprain something and it comes right back and it's no big deal. If it hurts for less than 24 to 48 hours, just give it some time, it'll get better. But if it doesn't heal, it's a really good, most likely your body's going to start creating compensation patterns around that. You're going to start walking differently. You're going to start holding your shoulders differently, and then when that headache comes on 6 months from now, you'll be like, well, that's weird. Nothing changed. Well, kind of. Remember when you stubbed your toe and you walked really funny for 6 months? Yeah, that actually affects the whole system. So, things like that, just to get checked out. It's just a good idea to have someone look at your body from time to time, like a dermatologist. You want them to check your skin from time to time. Just make sure nothing's going on that is not familiar to you and that's not something that's in your radar.
Yes. Well, Dr. Michelle, this has been really fun and really educational, and it's you're a great teacher and explain things in a way that those of us who don't have your training can mostly understand. I'm still I'll have to listen to this tape over it.
Well, you know where to find me if you have questions.
I see it about once a month anyway. So
right. Well, and I always offer free consultations. So if anybody else feels like they want to find out if they need a chiropractor, not only will I chat with you on the phone, but I'll also give you homework exercises if you need them, which I can send to you through email. And then I'll also help you find a chiropractor in your area that's appropriate for what it is you do. I help people find chiropractors all the time because I want the one you go to be the one that gives you a good experience. So that's why I do that.
Cool.
Yeah.
Cool. All right. So what's the easiest way for people to get in touch with you?
It's probably through my website, allseasonschiropractic.com. And then there's a contact us button. It's really easy. You can also call the office and leave us a message. I get back to people pretty quickly. But if you send me an email, I usually respond within 24 hours, unless I'm on an island in the Caribbean or in Bali or something like that. But yeah, I pretty much respond within 24 hours regardless. So reach out if you have a question. If you're just curious about something, let me know. I never charge anyone to chat with me.
All right. Okay. Well, thank you again. And, we'll look forward to the next time that we do this.
Sounds good. Thanks, Scott. Yeah, we'll definitely do that again soon. You're amazing. Thank you.